Many more are screened. Some in the village are just now arriving, hoping to receive something, anything for their condition. Meanwhile, SCORE dentist Mike Foreman and his team are already performing various types of procedures. A lack of dental hygiene is clearly evident in many patients examined here today. Some need teeth pulled or basic cleaning. Others need much more.
She has bad gum disease, and there's nothing I can do for her today.
As patients are treated, SCORE team members fill prescriptions. Other team members, like Linda Foreman, disperse medication.
We're in a Haitian village where a lot of the people speak Creole, and so we have to translate from our English dosage for the medications into Spanish, and then we have a person who speaks Creole to translate it from Spanish into Creole. So we have a three-way communication here to dispense one medication. That's what's happening at this window.
We feel like the Lord has called us into this new project. There's a great amount of need here, both medical and dental. And of course, when we can meet their physical needs, then they are more receptive to listening to their need for Jesus Christ.
Our medical team has come here from the United States to not only meet the physical needs of this, but because SCORE is such a team-oriented ministry, we're working hand in hand with Jay Munoz, who's doing church planting, who has already made contacts here. And then we're going to come in and also meet some of their physical needs. The physical needs combined with the spiritual needs let these people know what is in fact true, that we really care for them. We're not just headhunters and counting souls and counting numbers, but we care for these people. We want to meet their physical needs. We want to meet their spiritual needs. And we want to meet their needs long term.
You don't have to hold a medical degree to be able to help on a medical mission. We have many teenagers with us and many ladies that are here accompanying their husbands, and you can have a very valuable contribution to make to the mission as well, because it takes a whole team to be able to pull one of these off.
It's exciting working as a team because you're not out here by yourself. You're not doing a solo thing. You know there are people behind you both praying for and working with you. Our team here is already like 25 people today, and by God's grace, in ever-expanding circles, we'll start meeting the physical and the spiritual needs of this country. So that's kind of what this medical ministry is about, a short-term trip here for a week.
If you've ever thought about doing a trip like this, I would just encourage you to do it. It's quite rewarding and very safe. We take all the precautions to provide the sterilization that protects not only our patients but those who are working with the clinic. There's a job for everyone that's got a willing heart, and no matter how young or old you are, that God can still use you in a mighty way for His work.